Roar the dinosaur. Is it a good idea to remove bullets lodged in your arm? Hey, I think you're here because you want to know what happens to gum. And I'm going to answer that question along with a bunch of others. I'm responding to comments. That's what we do on this channel. We talk all things health while having a good time, but this is evidence-based fun. Let's do it. I'm going to go ahead and assume that what you're talking about is an old bullet, like something that's been lodged inside your body for a long period of time. Not all bullets have to be removed. Some, if they're not causing a problem, you can do more harm than good by removing them and going in operatively. Some need to be removed right away, and some can be problematic because they could be a source of infection. So it really depends on when it happened, how it happened, the area where they are, what your anatomy is like. But what I could say very confidently is you shouldn't remove bullets lodged in your arm. Let a doctor do it. Let them decide if it's warranted or even safe to do so. Jillian Arthur, do patients get ticklish? Oh yeah, they do. I mean, my pediatric kids especially. Like when I'm pressing on their belly, if I want to check for appendicitis or whatever, I'm checking in their belly and I'm pressing and they're laughing and they're not in any pain, I already know that it's very unlikely to be an acute abdomen. So I like when my patients laugh and are ticklish because then I know nothing serious is going on. Can taking large doses of Benadryl 15 daily for sleep cause long-lasting damage? Yes. Do not take 15 Benadryl at night for sleep. Seriously, that's asking for trouble. Benadryl is not a benign medication. It truly has side effects. If you're needing 15 Benadryls to sleep, that's a sign that something's not right going on inside your body and you should be evaluated properly by a doctor. Yes, the potato is looking at you. First of all, dope username. How can one decrease their libido asking for a friend? Decrease their libido? Every question I've ever been posed by a patient has always been to increase their libido. If you're asking to decrease your libido, perhaps there's something going on medically that should be evaluated. There's rare conditions that can cause you to have an overly increased libido. If you're really asking for a friend, tell them to go see their doctor. Ali Cato, why do my ears hurt after I wear my headphones for a couple of hours? If you're talking about earbuds, I have the same problem. Like I have the Apple AirPods and after a while, the plastic starts putting pressure on my tragus here and it really hurts after a while. The over-ear headphones generally should be pretty comfortable and not causing you pain, especially superficially on the outside of your ear. If your inner ears hurt, that's a sign you're listening to your music too loudly. Generally, what I recommend is no louder than 60% of the volume that you should be listening on your phone. Alan Balse, do hats/caps cause baldness? In very specific circumstances, meaning that if you're wearing a really tight baseball cap or some kind of scully where you're actually putting traction on your hair, that can cause a type of baldness called traction alopecia. I think that's exactly what it's called, where you're actually pulling out your hairs from that constant pressure. But otherwise, if you wear a hat that's well fitted and not overly tight, it's not gonna make you lose your hair. In fact, most men will incorrectly assume that this can happen because they like wearing hats, they experience male pattern baldness, which is a hormonal issue, has nothing to do with the hats, and then they'll go ahead and blame the hats. That's an area of correlation versus causation. Like men wearing hats at a certain age, experiencing baldness at that same age, they think, oh, look, these two things happen together, they must cause one another. They don't. Sarah Darwich, question for Dr. Mike. How and when do you recommend eating around night shifts? I find it hard to plan. I do not have great advice on this from a personal standpoint because every time I was on night shift, it was absolute mayhem in the hospital. The thing that I tried to do was anytime I had a moment of silence, I would go and eat something small, so that I always had some kind of food at the ready, whether it was a small salad, a protein bar, some kind of fruits to go. Something small will keep you feeling full, energized, as opposed to just eating one giant meal in the middle of the night, getting overly full, sleepy. That's gonna make your life complicated. And the one thing I would avoid at all costs, if possible, of course, is caffeine at night, especially if you're alternating between day and night shifts. That'll throw off your circadian rhythm really badly. Fluffy toast. I would love for some fluffy toast right now because I'm Whole30. No toast for me. I have really sweaty hands. What causes it to really sweat, and is it normal? If you have really sweaty hands, that could be a condition called palmar hyperhidrosis. Palmar meaning the palm of your hand, hyper meaning more of, hidrosis, sweating. This isn't that of an unusual condition, but it causes a lot of distress to people because when you're shaking people's hands, interacting, it's obviously very uncomfortable. Treatments for this usually are antiperspirant, like the thing we use under our arms, but here to plug those sweat glands. The glands that are found here are mostly eccrine sweat glands, which start sweating not to thermoregulate your body to cool you off, but really as a result of nervousness. You have the sympathetic nervous system, which is your fight or flight response nervous system. That's what happens when you see a lion, when you're about to give up speech, when you're arguing with your partner. That's why your hands sweat. As a result, those sweat glands start releasing that fluid. Now, when you put antiperspirant on, you essentially block those ducts, no fluid gets released, you sweat less. Sometimes they don't work. You can use clinical strength products. If that fails, there's always Botox injections. Yeah, you can actually inject Botox into the sweat glands of your palm to reduce that sweating. It works really well. I've had some doctors talk to me about it because I have underarm sweating that's pretty bad, and I might be doing that in the future. In fact, if you want me to make a Botox sweating video injection into me, God, I couldn't phrase it any worse, leave it down below in the comments. I want to make videos, at least a series, of different medical procedures being performed on me. If you're game, hit me in the comments. Jude Bratton, what eyesight does require glasses? I think you mean like, what should my eyesight be that I would need glasses? Well, glasses are important. First of all, I wear them. They can help with issues like farsightedness, nearsightedness. The ideal vision that many professions require is 20/20 vision, which means that you can see an eye chart from 20 feet away as well as a person with normal vision can see from 20 feet away. If you have 20/30 vision, that means you can see from 20 feet what they can see from 30 feet away, meaning someone with normal vision can see better than you. So 20/30 is worse than 20/20. There's no rules for this. If you have 20/30 vision, 20/40 vision, you may have that in one eye, in both eyes. You need to have a conversation with your optometrist or ophthalmologist. Some cases where you need perfect vision for your job, it's important to correct your vision early on. In some other instances where it's not a big deal and you're sitting in front of a computer, it might not be so important for you. I will say that if your vision is chronically bad and you're squinting and you're straining, that can cause headaches, irritation of your eyes, all sorts of issues. So I do recommend you go get your eyes checked. That's part of being a healthy person. Panic at the LSD sco. Sometimes I get random sharp pains from my uterus that don't always happen on my period and they can make me double over. Is this normal? Interesting that you can exactly pinpoint that it's happening in your uterus as opposed to your ovaries, your fallopian tube, your stomach, your intestines. If it's not happening along with your menstrual cycle, perhaps there's a good reason for you to go see your doctor and make sure that it's not something going on with your gastrointestinal system. There could be many different things happening, and that's why I think you need a doctor to sort of isolate other symptoms that may be going on simultaneously. Again, the best way that doctors make a diagnosis is through a careful history, asking you questions about what's happening and what other symptoms are going on, and two, doing a proper physical exam, putting their hands on you, checking certain aspects, pressing, listening with the stethoscope. The art of the physical exam is not lost. Lorena Pleska, does gum really stay in my system for 7 years if I swallow it? I need to know. I must know. Where did this urban legend start from? If somebody can tell me in the comments, I'm gonna be so grateful for this. If you swallow gum accidentally, your teacher called on you, someone yelled, it's gonna come out of you with poop, generally in a day or two. Do you know how I know that gum doesn't stay in your system for 7 years and I can prove it? Because I've done colonoscopies. I've done capsule endoscopies on patients. I've literally given them a capsule with a camera, goes through the digestive system. Guess what? No gum. Nothing hanging out there for 7 years. Gum is just basically like plastics. Sometimes it's like resin. Your body can't digest that. It can digest the sugars and stuff around it, but it can't digest the actual gum. So it essentially just makes its way through your digestive system. Now, that doesn't mean you should just start swallowing a ton of gum, because what can happen, and I've seen case reports of this, is if you swallow too much gum, it can form like a big ball and then cause an obstruction. Or if you swallow gum and then some kind of weird substances around it, like a coin, batteries. I mean, these case reports happen with children. The gum can encapsulate the coin or the battery or whatever, and then cause a blockage as well. But if you just swallow gum occasionally, it's gonna come out in your poop, not the end of the world. Don't worry about it. Kira's Cloud. How bad is it to inhale helium from a balloon? All I'll say is, it's not ideal. The only thing you should be breathing in is air. Notice I didn't say oxygen, because if you breathe in 100% oxygen, kind of doesn't make sense, because atmospheric oxygen is around 20%. See how I knew that? I went to school. I remember some facts. I don't know why I thought that was fun to say. Marie Teresa, like Mother Teresa. Let's say you're educated on how to do CPR, but not licensed. Somebody drops and needs CPR. No one there knows a thing about how to do it. Is it best to help the person? Will you get in trouble? Good Samaritan law should protect you in this instance, because if the person's heart truly did stop and they need CPR and you don't do it for the fear that you may do it wrong, that person's already gone. You need to do CPR. We need to not be afraid to do CPR. In fact, a recent study has come out and shown that women get less CPR when they have a cardiac arrest, their heart stops in public, because people are afraid to touch female chests. We should not be afraid to do this. If someone's heart stops, meaning they have no pulse, so they're not breathing and they're unconscious, please do CPR after calling for help so that you can extend their chance of survival. We need to be doing CPR. There's huge movements from New York Presbyterian Hospital to the American Heart Association talking about hands-only CPR, about how effective it is. We should all learn how to do it, and being licensed should only apply in a healthcare setting. It has nothing to do with if someone drops and goes into cardiac arrest immediately in front of you at the mall. Julia Kaiser, can leaving glass in your foot cause long-term harm? It's gonna cause long-term pain. Glass is not supposed to be in your foot. Like, is it gonna cause permanent harm? Not usually, unless you have like diabetic neuropathy and you don't feel it and it's constantly causing an open wound there and you can get an infection that way. It's probably not the end of the world, but if you see it, if it's causing you pain, it needs to be addressed. You don't want to have an open wound in your foot. Why? Because if you have an open wound in your foot, that's where bacteria might come in and say, what up? When bacteria come in and say, what up? And you get an infection in your skin, that's called cellulitis. What's near your skin and your bone? I gave it away. What's near your skin? Bone. If you get a bone infection, that's called osteomyelitis, because infection can spread from the skin to the neighboring bone. What happens then? Ooh, IV antibiotics for a while. That's problematic. Your foot's gonna hurt a lot. Get that glass taken out. Here's a playlist of my favorite responding to comments videos. I know you're gonna love it, so click that. Don't forget, if you have questions, leave them down below so I can answer them. In fact, I'm gonna go look at them right now. You're gonna be in this playlist though, right?